Good afternoon, dear patients. Today we will discuss a clinical case presented in the picture. The patient has an itchy penis after oral sex. It's been about 5 days since the sexual encounter. He thought it would all go away, but accordingly, the itching did not subside. As you can see, there is a redness on the glands and foreskin of the penis, there is peeling, and even in some areas there are erosions. Naturally, in such a case, tests were taken both from the surface of the glans penis and from inside the urethral canal. First of all, for sexually transmitted infections, including the ever-popular Candida or thrush. Secondly, cultures were taken from the glans and foreskin, as well as from the urethra for bacteria and for the Candida fungus. Practically all of these tests, except for the culture from the glans, came back negative. On the glans, Staphylococcus was found, as well as a bacterium called Morganella. Well, this is quite a common bacterium, but it is more often found in the mouth. In other words, there were no sexually transmitted infections. In addition, his partner was also tested, including a test from the mouth, but she also had no sexually transmitted infections. In addition, the patient underwent the main allergy test, immunoglobulin E, complete blood count, circulating immune complexes, eosinophil cationic protein, and so on. You can watch a separate video on our channel about what a blood test for allergies are. And these test results were also negative for the patient. Accordingly, we concluded that, first of all, this itching was triggered by intense oral sex and essentially by chafing. And secondly, well, the patient was already quite advanced in age. He was over 50 years old. The connections between the skin cells are already quite weak, and therefore, with the same kind of irritation, such skin peeling occurs. That's the first point. And secondly, the same Morganella and other bacteria, when intensely rubbed into the surface of the glans penis or the skin of the penis, could also cause this kind of redness, itching, burning, and so on. These two factors played a role in this case. Accordingly, the patient was prescribed topical compresses, the topical cream Triderm, and also topical creams like Videstim or Ferrital to soothe the skin. In addition, the patient was prescribed medications to promote healing such as methyluracil, sodium sulfate, and calcium gluconate. And against this very Morganella, an antibiotic was prescribed according to sensitivity. Additionally, instillations were prescribed to eliminate this bacterium from inside the canal, not just from the glands. And the enzyme longidasa was prescribed to enhance the penetration of antibiotics. After about 10 days, the erythema had almost completely resolving through peeling. A follow-up test was taken from the patient for this bacterium, a bacterial culture, for Morganella, which came back negative. It was not taken immediately, but 2 weeks after the completion of the antibiotic course. Accordingly, this case shows that, firstly, any redness of the glands, skin, itching, and other symptoms on the penis should be properly evaluated using tests, not just by eye. These could very well have been sexually transmitted infections even after a short period of time. Secondly, again, you shouldn't attribute every redness or itching on the penis to a yeast infection. In this case, there was no such infection. In particular, there was no yeast infection either on the glands or inside the urethra. And it was checked using both culture methods and PCR analysis from the surface and inside the urethra for 8 types of Candida fungi, which is quite sufficient. Taking all of these important factors into account, it remains absolutely necessary, especially as one reaches an older age and the body's natural defenses weaken, to maintain a consistent and thorough routine of personal hygiene and regularly use reliable antiseptic products like Miramistin to ensure your continued health and well-being. Even in terms of caring for the genitals after sexual intercourse, it should be done more regularly, so to speak, even if you are completely confident that your partner does not have any sexually transmitted infections. The fact is that elderly people are particularly susceptible to various bacteria and opportunistic pathogens that live in the mouth, in the vagina, in women, and when it comes to the penis, can affect it as well.